Jess.
Good morning.
My name's Rachel. I'm going to be your student nurse today.
Nice to meet you.
How are you feeling today?
Feeling good.
Good. Any pain?
No.
Great. That's awesome.
Yeah.
And can you tell me where you are?
I am at the hospital.
Okay. And can you tell me the day?
Oh, it is April 20th?
Do you know what day it is? Friday, Monday, Tuesday,
Oh,
Wednesday?
I know it's Friday.
Okay, great. I got a little concerned there for
Wait
a second.
a minute. It's
And
19th.
Can you tell me your name?
Jessica Harrington.
Good. And your date of birth?
7/28/86.
Okay, great. So we're going to start off today by just taking some simple vital signs, your blood pressure, your heart rate. We already assessed your pain. We're going to look at your oxygen saturation and take your temperature.
Perfect.
Okay? Thank you.
Definitely.
Just feeling for Jess's brachial pulse. It's right here. It's about a 2+, which is great. You're going to feel this cuff get a little bit tighter, all right?
Okay.
So your blood pressure is 110/72, which is great.
Okay.
Just going to take your temperature.
Okay.
Jess's temperature is 99 degrees Fahrenheit. So now I'm checking Jess's right radial pulse for her heart rate. Great. Your pulse is about a 74 right now.
Great.
And while I was doing that, I was also checking Jess's respirations, and her respirations is at 16 right now.
All right.
And Jess is also hooked up to an ear oxygen saturation. Her oxygen is at 100% right now.
All right.
So we're just going to take this off. And now what we're going to do is we're actually going to do a full head-to-toe assessment.
Okay.
Okay?
Sounds good.
And before we took vitals, Jess's weight is 140 pounds, and she is 65 inches tall. So I'm just actually going to raise the bed.
Okay.
I'm actually just going to put down the side rail because Jess is not at risk for fall.
Great.
And the first thing I'm going to do is I'm going to look at her hair. Hair looks good. It looks well groomed. It's beautiful, actually. And the first cranial nerve that I'm going to assess in the neurological assessment is smell. So I'm just going to have you go like this. That's it. And same on the other side. Good. And can you smell okay?
Yeah.
Okay, great. So the second, third, fourth, and sixth cranial nerves actually are your eye movement, your pupil constriction, and the 6 cardial movements. So we're going to do that next.
Sounds great.
So I'm just going to ask you to follow my finger, keeping your head completely still. Great.
Great.
Now I'm actually going to ask you to touch your nose and then touch my finger. Great. Then I'm just going to put my fingers back here, and I need you to tell me right when you see my fingers.
Okay. All right.
Okay, great. So then the 5th cranial nerve is actually checking your jaw clenching.
Okay.
Okay. So I'm just going to ask you to clench your... Good. And don't let me push down. Great.
Excellent.
The 7th cranial nerve is the facial. So I'm just actually going to have you close your eyes, and I'm going to touch your face, and I just need you to tell me when you feel something.
I can feel it. I can feel it. I can feel it. Now, now, and now.
Good. Now can I have you put on a nice big smile and a frown and puff out your cheeks like this? And then we're going to assess the 8th cranial nerve, which is hearing.
Okay.
Tell me when you hear something.
Yep. Yep.
Great. And is there any pain or tenderness?
No.
In your ears here? Good. Then we're going to assess the 11th cranial nerve. I'm just going to ask you to shrug your shoulders up. Great. I'm going to ask you to push against my hand with your face. Good. Good. And then the last cranial nerve is number 12. It's just your tongue.
Okay.
So I'm going to ask you to stick out your tongue. Waggle it all around. Perfect. And also, the last thing I'm going to do to further assess cranial nerve 2, 3, 4, and 6, I'm going to use this light here.
Okay.
I'm actually going to ask you to look at something in the ceiling over there.
Okay.
And I'm just going to shine this light in your eye to see your pupil constriction. Good. 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 So all of Jess's pupils during that went from about a 4 to a 3, which is perfect. Now I'm just going to ask you to squeeze your eyes shut. Good. Blink for me. And move your eyebrows up and down. Great. Now I'm just going to quickly
Okay.
check your sinus pressure.
No.
Good. Any tenderness?
No.
Pain?
No.
Great. So now we're going to move further down. We're going to look at your neck. There's no signs of jugular venous distension on either side of your neck. Your trachea is midline. Your skin is warm. It's pink. There's a couple of freckles, but who doesn't have freckles? Looks great. I'm just going to feel for your carotid pulse. It's right here. It's about a 2+. I'll go over to the other side. It's right here. And once again, it's a 2+. It's great. So while I'm here, I'm going to listen for any groups and just listen. All of that sounds great. I'm just gonna look in for bruise. Great, so there's no bruise present on either side of your neck.
Great.
Perfect. So now we're actually just gonna move down to your chest.
Sounds good.
I'm just gonna untie this
Okay.
for you. Okay. And the first thing I'm gonna do is I'm gonna inspect Jess's chest. Once again, the skin's intact, it's warm. The capillary tissue seems great because capillary refill in her chest is less than 2 seconds. There's freckles on her chest still. No ulcers, no wounds, no sores, no nothing. So the next thing I'm going to do, I'm just going to palpate her chest to check for any masses. No masses present, which is great.
Good.
So the next thing I'm going to do is I'm actually going to percuss. Thank you. Good. All signs of tympani, which is great. And the last thing I'm going to do is I'm going to auscultate.
Great.
Just going to listen to your lungs.
Perfect.
If I could just have you take a deep breath for me. Great. And another one. Good. 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 And 2 more. Great. I actually forgot to do tactile thermitis, so I'm just going to do that right now. Just going to have you say 99.
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99.
Good. 2 more times.
99.
Good.
99.
Good. Perfect. So I'm feeling vibrations in all lobes of your lungs, both
Great.
lungs symmetrical. I'm hearing clear lung sounds throughout both lungs, so perfect. Great. And I wanted to ask you a few questions.
Sure.
Any shortness of breath?
No.
Do you have a cough?
No.
Any respiratory diseases?
No.
Great. So now we're actually going to move into the heart.
Okay.
Okay. Just going to palpate around your heart. Feeling no masses. Any pain or tenderness?
No.
Great. Any chest pain?
No.
Any history of any heart problems, heart disease?
No.
Great. What about any fatigue or weakness?
No.
Perfect. Now I'm just going to listen to Jess's heart. I'm going to start on the left side. I'm going to go down to the second intercostal space. I'm going to listen for the aortic. S1 and S2 present. Rate and rhythms normal. No murmurs. No dysrhythmias. Perfect. So then we're actually going to go to the second intercostal space on the right side of the sternum. And we're going to listen for the pulmonic. Heart it sounds a little bit louder here. S1 and S2 are still present. Beat and rate regular, rhythm regular. And we're going to move down to the third intercostal space. We're going to listen at Herb's point. S1 and S2 still sound great. Rate and rhythm normal. And we're actually going to go down to the fifth intercostal space, which is the tricuspid. S1 and S2 are still present. Rate and rhythm's regular. We're going to go over to the apical with our mitral, which is right below the nipple, mid-clavicular line, fifth intercostal space. Just going to check your pulse. S1 and S2 present, rate regular, rhythm regular. And your radial pulse matches up perfectly with your heartbeat.
Great.
So now we're going to move down and we're going to do your abdomen.
Sounds good.
I'm actually just going to lower the bed though,
Great.
so we can have you in a flat position.
Okay.
So the first thing I'm going to do is I'm actually just going to inspect Jess's abdomen. It's flat. I don't see any pulsations. She has a recent belly button piercing with no ring in there. Her skin color looks pink. All looks well. Are you having any abdominal pain at all?
No.
What about any cramps, muscle spasms in your abdomen?
No.
Good. And when was your last bowel movement?
Yesterday.
Great. The next thing I'm actually going to do is I'm actually going to listen. I'm going to start listening. In the right lower quadrant, and I'm going to work clockwise. So all four lobes in your abdomen sound great. There was gurgling, there was peristalsis occurring. It sounded great.
Great.
Now what I'm going to do is I'm actually just going to percuss.
Okay.
While percussing, all signs of tympani resonance sounds great.
Great.
Now I'm just going to palpate very lightly in all four quadrants. Appears to be no masses or anything. So then I'm going to do a deeper palpation. Let me know if there's any pain or tenderness.
Okay.
Any pain or tenderness?
No.
Great. No enlarged organs, no masses. Feels great.
Great.
So now I'm actually just going to look at your legs. First thing I'm going to do is I'm just going to feel for any edema in the legs. There appears to be no edema in Jess's right leg. Appears to be no edema in her left leg either. While looking at her skin and touching her skin on both legs, I notice there's a couple of patches of dry skin. Do you have psoriasis?
I do. Yeah.
Okay. Do you use any prescription medication or ointment on it?
I have a prescription. I don't often use it.
Okay. Why don't you use the prescription?
It hurts a lot more than it helps. Melts my skin.
So the patches of psoriasis, that's not good.
No.
The patches of psoriasis appear to be very dry. They're red. They don't look irritated or infected. Or does it hurt when I touch it?
No.
Okay, great. Other than that, her legs look great. There's freckles on her legs. Her legs are warm. They're pink. Her skin's intact. On her other leg, her left leg, she has one spot of dry skin under her knee, but that appears like it's healing or dry and flaking off. Maybe we can get you some lotion to apply on that.
Okay. Sounds good.
The skin is warm. It's intact. More freckles, but they look great.
Oh, good.
Any numbness or tingling in your legs?
No.
And no pain when I was feeling?
Nope.
Okay, great. So now we're going to go down to her feet, and I'm actually just going to test her posterior tibial pulse. It's right here. It's about a 1+. Go over to her other side. On our left side, the same pulse is still a 1+. So just to be certain about that, I would use a Doppler. And go to our dorsalis pedis pulse. Actually right here. It still feels a little bit weak, so it's a 1+. On the other side. Pulse also feels very weak, so it would also be a 1+. So I would also use a Doppler on both of these pulses too, just to be sure. Now I'm just going to inspect Jess's feet. She has a little dry skin on the edges of her heel, but it's no ulcers, no sores or anything. Her skin is still warm. It's intact. Some freckles on her left foot still, but her left foot appears warm and intact also. Just going to check toenails for capillary refill. Her capillary refill on both feet is less than 2 seconds, which is great. Her toenails appear good. They have regular color, regular length, and everything.
Great.
Good. So now actually, can you push up on my feet? Hands? Thank you. And we'll push down on the gas pedal. Great. Now I'm actually just going to ask you to take this heel and put it up to your knee and rub it down.
Okay.
Good. And same with the other leg. Good. Perfect. So now I'm actually going to ask you to get over on this side of the bed, dangle your feet this way. Just going to check your respiratory system and your lungs from the back side. Is that comfortable for you?
It is.
So the first thing that I'm going to do is I'm just going to inspect the backside. She has some marks where she was laying down from the sheets. She has some freckles. It's a little red right here, but I think that's just from laying down. We'll keep an eye on that. Other than that, her skin feels warm. It's intact. No sores or anything. So first thing I'm going to do is I'm actually just going to palpate. Let me know if there's any pain or tenderness.
Okay.
Good. No masses or anything. Now I'm just going to ask you to say 99.
99,
Good.
99,
Good.
99,
Good.
99,
Good.
99,
Good.
99,
And one more time.
99,
Good.
99.
Vibrations appear in all lobes in both lungs, which is great, because there's no fluid in your lungs. Next thing I'm going to do is I'm going to percuss. Signs of resonance and timpani, which is great. The last thing I'm going to do is I'm actually just going to listen. So I'm going to have you take a deep breath. Good. 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 Perfect. And two more. Great. Everything sounds good. Your lungs sound clear. In all lobes of both lungs, which is great because that means both lungs are symmetrical.
Great.
Just going to tie this back up for you. And then I'm actually going to ask you to change positions and dangle your feet this way.
Great.
Perfect.
Thank you.
So we're just going to check your reflexes now.
Great.
But before that, I'm actually going to check your pulses in your arms. We already checked your radial pulses. Both radial pulses were 2+.
Great.
Your ulnar plus here is a little bit weaker, so I would say about a 1+. We already checked this pulse doing blood pressure. I'm just going to double check. Still at a 2+.
Great.
Radial pulse was a 2+ on this side. Her ulnar pulse here is still a little bit weaker compared to her radial pulse, so I'm going to give that a 1+ also. Brachial pulse on her left side is a 2+. The carotid pulses earlier were a 2+. Those are all your pulses.
Great.
So we already checked your feet pulses. So now we're actually just going to do some reflexes.
Okay.
Just going to have you relax your arm. Perfect. Good. And relax your arm one more time. Perfect. Not as strong on this side. Oh, there we go. Perfect. Relax your hand just like that. Thank you. Perfect. can actually move down to your legs. Just gonna move the camera. Actually just gonna stand on this side so you don't accidentally kick me. And is that gonna hurt if, because it's right around this spot? Is that spot hurt?
Not at all.
Okay.
Thank you for asking.
Good. There's a little one. Let's see if we can get a better one here. One more time. There we go. There's a little one. Oh, there we go. That was a good one. So now I'm just going to ask you to relax your foot on my hand. I'm going to check your Achilles tendon. There's a little movement there. There we go. The last thing we're going to do is we're just going to do this. Perfect. Perfect. A little ticklish there, I see.
A little bit.
And the last thing that we're going to do is I'm actually going to have you hold your arms out like this.
Okay.
Don't let me push forward. Don't let me push out. Good. And same for your legs. Don't let me push in. Don't let me push out. Perfect. So our muscle grading on all of our extremities are actually a 5+, which is great. So Jess, that's our head to toe assessment.
All right.
It was great. I'm going to help you get back into bed.
Sounds perfect. Thank you.
Just going to lower your bed. Good. So we're going to put the side rail up just for your safety.
Okay.
Do you want the head of the bed raised?
No, I'm good. I think I'm going to take a nap.
Okay, great. Do you need anything before I leave?
No, thank you so much.
Okay, perfect. Thank you for letting me do my assessments on you.
Oh, thank you.
You were a great participant.
Thank you.